Assalamu alaikum, dear students. This is lecture of gross anatomy, lower limb for first professional MBBS students. The topic of today is the anatomical areas of the thigh, the femoral triangle and the adductor canal. I am Dr. Karibullah, Demonstrator, Anatomy Department, GKMC Swabi. The surface anatomy of femoral triangle, as it is very well evident from the name triangle, it is a triangular space. And on the anteromedial aspect of the thigh, so on both sides of the thigh you can see a triangular area underneath the surface of this particular skin. You can find the femoral triangle. In this slide, before you is a triangular schematic diagram, and this is the diagram of the femoral triangle. You can see S, L and M. These are the superior, the lateral and the medial borders of the triangle. The superior border is formed by the inguinal ligament. The medial border is formed by the medial border of the adductor longus muscle. The lateral border is formed by the sartorius muscle. The roof is formed by the fascia lata, the deep fascia of the thigh region. The contents are the femoral nerve, the femoral artery, and the femoral vein, and the deep inguinal lymph nodes. The floor, marked by the muscles with the adductor brevis just showing it has the anterior division and the obturator nerve on its surface. You can see along the adductor longus, and in between the adductor longus and the pectineus muscle is the adductor brevis muscle, and the dot you can see is the obturator nerve. Then the pectineus and psoas and iliacus, all these form the floor of the femoral triangle. The contents you can see, the yellow is the nerve, the red is the artery, the blue is the vein, and the grape-like green structures are the inguinal lymph nodes. The borders of the femoral triangle. In the lower small diagram, you can see a bone which shows the ASI, the anterior superior iliac spine of the pelvic bone, and the pubic tubercle and the pubic symphysis. A ligament is stretched in between these two parts, and this ligament is called the inguinal ligament, and it forms the superior border of the femoral triangle. The lateral border is formed by the sartorius muscle, and the medial border is formed by the adductor longus muscle. On the left side of the diagram, you can see. On the upper and the right side, you can see the contents of the femoral triangle. These are the yellow is the nerve, the red is the artery, and the blue is the femoral vein. In the femoral vein, the great saphenous vein, which is the superficial vein, is going to enter. The floor and the roof of the femoral triangle. Interiorly, the roof is formed by the fascia lata, which is the deep fascia of the thigh. The base is formed by the pectineus, the iliopsoas, and the adductor longus muscle. Inguinal ligament supports the contents during flexion of the hip joint. And in the above diagrams, you can see the borders and the contents of the femoral triangle. The contents of the femoral triangle. If from lateral to medial we go, we can find the femoral nerve, then the femoral sheath, which encloses the femoral artery, the femoral vein, and the femoral canal and the lymph nodes. For the sake of convenience and in order to easily memorize the contents of the femoral triangle, a formula by the name of navel. You can remember N for nerve, A for artery, V for vein, E for empty space to allow veins and lymph vessels to distend so they can cope with the different levels of flow, and L for the lymphatics in femoral canal. Clinical relevance of the femoral triangle. The femoral pulse. The femoral artery is palpated midway between the pubic symphysis and the anterior superior iliac spine, and these are shown in the diagrams. The palpation you can see in the diagram, and the arrangement of the blood vessels and the inguinal ligament you can see also in the diagram, that the femoral artery is passing midway in between the pubic symphysis and the anterior superior iliac spine. As the femoral artery is quite superficial and we can easily palpate it between the anterior superior iliac spine and the pubic symphysis. So we can catheterize it in order to draw blood, arterial blood for the an assessment of arterial blood gases and coronary angiography and the coronary angioplasty. The femoral sheath is made by fusion of the fascia iliaca behind and in front by the fascia transversalis. It is a fascial envelope surrounding the structures in the femoral triangle somewhere down behind the inguinal ligament. It provides separate compartment for each structure to pass in. The femoral nerve lies outside the sheath. The femoral vein has got a bit larger compartment in order to dilate easily. The femoral canal. It is the smallest and most medial part of the femoral sheath and approximately 1.3 cm long. The location and shape of the femoral canal. It lies in the anterior thigh within the femoral triangle, and it is rectangular in shape. The femoral canal has four borders. Medially, the lacunar ligament, laterally, the femoral vein, anteriorly, the inguinal ligament, and posteriorly is the pectineal ligament and the superior rami of the pubic bone. The opening of the femoral canal. It is called the femoral ring. It is present at the superior border of the canal. It is closed by the femoral septum and it is pierced by the lymphatic vessels. The contents of the femoral canal. The lymphatic vessels. It is draining the deep inguinal lymph nodes, and the deep inguinal lymph nodes are called the lacunar lymph nodes. The empty space is filled with loose connective tissue. The empty space allows distension of adjacent femoral vein so it can cope with the increased venous return or increased intra-abdominal pressure. The femoral hernia. First of all, the definition of hernia. It is a part of an organ displaced and protrudes through the wall of the cavity containing it. The femoral hernia is a part of a bowel or the intestine pushes into the femoral canal. It bulges in the area of femoral triangle as shown in the diagram on the right side. The adductor or subsartorial canal. It is an intramuscular cleft on medial aspect of the middle third of the thigh beneath the sartorius muscle. It starts from the apex of the femoral triangle and ends below the opening in the adductor magnus muscle, the adductor hiatus. The boundaries are found by anteromedially the sartorius muscle and fascia, posteriorly the adductor longus and magnus, laterally the vastus medialis. The contents are the terminal part of femoral artery, the femoral vein, the deep lymph vessels, saphenous nerve, the nerve to vastus medialis and the terminal part of the obturator nerve. Thank you. It was all about the femoral triangle and the adductor canal, the anatomical areas. Thank you very much.